Tonight and all this week, KVUE is talking about mental health. The pandemic has been a lot for all of us to handle, and instead of ignoring it, let's have a conversation. Let's try to heal. In part one, KVUE's Molly Oak looks at how families have dealt with their mental health throughout the past year as schools went virtual and kitchen tables turned into classrooms.
Oftentimes in life, we're expected to bounce back. Expected to just be okay.
Nice!
But after a year that was filled with the unexpected, dealing with life has had its ups and downs.
I think it's been an emotional roller coaster for sure.
Annie Canizales works 2 jobs, one at a rehabilitation center, the other as an ER nurse.
It has been the most interesting first year of nursing I think that I could have imagined. I actually started working on my unit 2 weeks before COVID was a thing and shut us completely down.
Sometimes it feels like maybe being at work on a 12-hour shift, battling COVID with a million patients is just easier than parenting.
With 3 kids, you can add mom and teacher to her resume.
I think that's where I've struggled the most this year because I've questioned a lot on how I'm parenting and whether I'm meeting my expectations for them and their emotional needs, and are they getting their homework done? And it's just been a lot with coming home after 12-hour shifts in a world that was completely new to me, and then now all of a sudden being a teacher, which I've known all my life. I am not meant to be a teacher.
Hello, I'm Rory, and I have 1 sister, 1 brother.
It's a full house.
Yeah, a full house of very busy kids, very opinionated kids, very happy kids, and kids that you can't really, as you can tell, slow down.
Now I'm a horse,
But this past year has forced things to slow down. Schools moved virtual, and Annie's oldest, a 4th grader with ADHD, saw his grades drop at school.
And while he's always been distracted, it's never been as bad as this year was.
And it's been a national problem that kids are not doing well.
Dr. Joanne Sotelo
We've had more referrals overall than ever.
Is a psychiatrist with Baylor Scott & White.
And it's very different, right? Like, it's not your typical referral for attention problems or little misbehavior here and there.
The Centers for Disease Control and Prevention found that between April and October, children's mental health-related emergency department visits not only increased but remained high. Compared to the year before, visits for kids ages 5 to 11 increased by 24%, while visits for 12 to 17-year-olds increased by 31%.
The kids are struggling a lot also with sadness and anxiety and kind of disconnection socially.
Having to explain to them, especially in the beginning of the pandemic, no, you can't go next door tonight, or you can't go across the street to your friend's house today. And then today turned into a week, and a week turned into, we're 12 months into this thing. Okay.
And while Annie admittedly struggled as a stand-in teacher,
You gotta clap for everyone. Like, why am I yelling during math time so much? Math is math. Why did they change it?
I'm confused on this one.
she says trying to get her children to understand the social impacts of a global pandemic was one of the toughest lessons Annie had to teach.
You can't really teach them the seriousness of what's going on in a way that they fully understand. So there was a lot of crying. There was a lot of why. Is she not my friend anymore? Do they not like me anymore?
You're on camera now.
I do get a little teary-eyed because I know, as you've seen as you were setting up, they're very social.
The camera's on camera.
The biggest, arguably the most impactful change, not seeing friends for months at a time and not really understanding why.
I think like 1 or 2 months. I don't remember.
That's sad.
Mm-hmm.
Do you miss them a lot?
Yeah.
But it took a long time and a lot of tears and a lot of kind of counseling to make them understand that it was nothing that they had done. It was just the way things were at the moment.
It's been a lot for everyone.
Where am I going to go wrong as a mother? Where am I going to go wrong as a nurse? Where am I going to go wrong as a wife? Because it's been an unprecedented level of stress, not just for me, but for every mother and every parent out there.
Annie is back on anxiety medication. She says it's helped her cope, helped her stay focused on what really matters, her family.
Joining us now is Molly Hogue. Molly, first of all, great job, an important story, and I think the overwhelming theme for me is the isolation is for everyone, at least in the beginning, and now we're trying to see people kind of get out of that. But that isolation is tough on adults. I can only imagine what it's like for kids.
My heart breaks for those kids just going through this. It's hard for us, but for them, it's so difficult.
And it was something I didn't even think about. I think because we have technology, we have Facebook and Twitter, Instagram, Zoom, all of these things. And you don't think about the kids who are used to just running across the street and playing with their best friends. And I just thought going from virtual to in person, then back to virtual would be tough. But that, oh my gosh, missing just hugging your best friend, goodness, I think we all need a hug after this year.
We all need many hugs.